Well, good morning. Thank you everyone for joining us today. My name's Simone Parker and I'm with our CalPERS Stakeholder Relations team. It's our privilege to host today's event and introduce your representative to the CalPERS board, Yvonne Walker. Before I do that, I'd like to explain the format of this meeting. It's simple. Yvonne will provide some updates on CalPERS. Following her remarks, we'll take questions as time permits. If you have questions, when it comes time, you can raise your virtual hand and we'll call on you. You can access this feature by clicking the heart icon in the toolbar at the bottom of your screen and selecting the raise your hand option. Once we call on you, you can click the microphone to unmute. If you need accommodations because you're unable to raise your virtual hand to ask a question, please send a message in our Q&A so someone from one of our moderators can assist you. If you need closed captioning, you can click the CC button on the toolbar to enable that feature. As a reminder, this webinar is being recorded and will be posted to our YouTube page next week. If you want to be automatically notified that the video has been uploaded, you can subscribe to our CalPERS YouTube channel. We only have an hour today, so let's make the best of our time. With that, I'm pleased to introduce Yvonne Walker. She's serving her first term on our board. Yvonne has served California and our nation for more than 35 years, working as a union president, retirement security advocate, experienced pension fiduciary, state worker, and Marine Corps veteran. She's known for being one of California's foremost leaders in fighting for pension and health benefits earned by our members and retirees. So please join me in welcoming Ms. Yvonne Walker.
Hi, good morning, everybody. It is great to be here. I wish I could see you all, but unfortunately, I'm just staring at myself, so like you. So I'm going to go really quickly highlighting what has been happening. I'm going to answer a few questions that I've gotten in advance, and then we'll open it up. And I'm going to do this quickly because I want to leave as much time as possible for that you on the line, we can get in as many questions as possible. So we just wrapped up the June board meetings, and our key agenda items included the review of the asset class performance, more work on the asset liability management process, and preliminary healthcare rates. And just as an aside, I just want to say that I'm happy that they are better than they were at this time last year, and we'll be voting on them at the offsite in July. So for our investments, this year is an especially important year for our asset liability management process. We do it once every 4 years, and it's similar to balancing out your bank accounts. We take a close look at the liabilities and the assets we'll need to cover them. So right now we're reviewing current investment strategies and updated projections for long-term pension costs. And we're always looking for ways to improve long-term outcomes. Our Chief Investment Officer, Stephen Gilmore, has proposed a modified approach. This approach, it's the TPA, Total Portfolio approach. It has worked well for several institutional funds, including the one he came to us from in New Zealand. The Total Portfolio approach, rather than investment targets for each individual asset class, it looks at it at the whole. It gives you a lot more flexibility and to be able to move around and respond to the market. Evidence has supported it, and so far we've been focused on investment risk, specifically how much risk the board considers acceptable. This month we considered the reference portfolio we'll measure performance against. And this refers to the performance of a portfolio made up solely of stocks and bonds. We're getting a lot of guidance and information from our CalPERS investment team, outside experts, and our board's investment consultants. We will be making final decisions about the next 4-year portfolio approach in November. So I'm going to move on to our healthcare. Priorities remain focused on managing cost, improving quality of care, ensuring access to care where members live, and equally important, ensuring members get care for their specific needs. We just received our preliminary rates. I think I told you we'll be voting on them in July at the offsite. We also received an update on the pharmacy benefits contracting process. I think I mentioned this the last time. They're coming up on their 5-year contract, just like we did for the health plans. And so we do know that pharmacy benefits are one of the primary drivers of overall healthcare costs. And this contract represents an important opportunity to affect positive change in areas such as affordability, quality, and transparency. So, and these negotiations is just one of the key levers we have to improve our members' options. So in the last 2 years, the HMO and PPO contracts were renegotiated for a 5-year period. And what that did was it helped us expand coverage options, added new health plan providers for members enrolled in Medicare Advantage and basic HMO plans. And one plan expansion approved for 2026 includes more Kaiser options in Monterey, pending some final hurdles. And, just like whenever you're trying to do something more, right? It is, sometimes you run into roadblocks and challenges, but we're going to keep working at it until we get it done. I will say Monterey County is one of our toughest markets to remain competitive in. I'll have more to report on the final premium rates and the pharmacy benefit manager contract award after the board offsite. So this is June. I'll have more to report in August, but I'm sure after the offsite there will be stuff up on the CalPERS webpage. And one last health item I want to talk about is there's a piece of legislation designed to improve the accuracy of healthcare providers listed in the directories of our health plans. Now, I would tell you, CalPERS is aware that our members have had to wrestle with this issue and often going to great lengths to make calls to find a new provider that is in network. This legislation will require health plans and insurers to be jointly responsible for making sure the directories are up to date on an annual basis. Specifically, requiring the directories to be increasingly more accurate to 95% over a 3-year period. I believe this will help our members find providers more efficiently and make better decisions when choosing health plans and providers, and will also reduce barriers to to finding care and getting outstanding care. So with that, I want to answer I'm going to move on, answer some few questions. Let me get my glasses because this is smaller print, right? So we had some questions that came in. One of them, I got it from Prudence Zeloweski. And I know I've heard other comments on this. It was, what is happening with the Blue Shield supplemental health insurance? I heard that it is expiring. Is that correct? Will I have to choose something else? So here is what I know. The contract between Blue Shield of California and the UC healthcare system is set to expire in July. The two sides have agreed to extend negotiations, but if they cannot reach a new agreement, the contract will terminate on July 9th, 2025. A separate agreement was reached in June between Blue Shield and the Hoag Health Network. And while these negotiations are separate and ongoing, we want to make sure that you're aware of which plans are impacted and what CalPERS members can expect. And so one of the things is, would Medicare members be impacted by this potential termination? And so there would be no impact to CalPERS members enrolled in the PERS Gold and the PERS Platinum Medicare supplement plans. Members enrolled in Blue Shield's Medicare Advantage PPO plan will receive letters informing them of the potential contract termination. However, these members may continue to seek any provider, hospital, or medical facility that accepts Medicare. Which hospitals are impacted? UC Davis, UCLA, UC San Diego, San Francisco, Irvine, and Riverside, as well as associated children's hospitals, facilities, and medical groups. And then it was, well, how will we be notified? Blue Shield mailed letters to potentially impacted HMO members notifying them of the possibility of the contract terminations. Members in the PPO plans will be sent letters at a later date. And if no new deal is reached, Blue Shield will match members with new primary care physicians to ensure access to care. I just want to tell you, we at CalPERS are committed to ensuring members receive timely updates on the contract negotiations. And if you have more questions, I think you can go on our website. In the perspective, they have FAQs there, goes into it in a lot more detail. John, you asked, will CalPERS sell its holdings in China corporations linked to the CCP? If not, why not? I don't have an answer for your question, but I will certainly bring it up in investment committee. Chuck, you said you've been retired for 30 years and never received an adjustment to keep up with buying power and the cost of living. Does that ever still happen? It does. I would ask you, Chuck, to call into the call center, the 800 number, right? And then just have them check your records. Maybe you've received it, but it didn't, hit your didn't hit you. And so again, I got the same question again. This came in from Claire about substitutes in the school districts, right? And we had a lot of confusion that came out, when CalPERS was informing the school districts that they were coding the subs under the wrong government code and giving them the right code. And this has caused a lot of confusion with school districts. We're approaching it, like as we get questions and different things, we move that on. And so Claire retired from the Turlock Unified School District, right? And she's been subbing. And now, they can no longer be contacted directly by the school sites or district office departments. And any request for a retiree to sub has to be approved by Human Resources. And that sounds to me like they're trying to make sure that they're doing everything right. And then she said there's another school district in Stanislaus County that has indicated it will not even consider using retirees to sub. Again, we'll continue working on it there, but I just want to make sure that there's no confusion. CalPERS never said that, they couldn't use subs. They just had to have it under the right government code. So Jay, you asked me to explain each and how the current status impacts CalPERS recipients already retired and not receiving any Social Security benefits. I would ask you to, I can't answer your question. It's a little vague for me. So, you can resubmit a question with a little more information. And then any further update on the retroactive payments for California state retirees that worked and completed their Social Security contribution and requirements, that new bill that was signed by President Biden before he left office? No, I do not have an update on that information. I'd invite you to go to the Social Security website. That was from F. de Guzman. And then, this is interesting. Janine, I got your question. I'm going to have somebody from our healthcare team respond to you. And then one of the questions that I found, and it actually got asked also when I was at a meeting in Chico. What happens, worst case scenario? What happens if, Medicare gets impacted so much that, it goes away? What's going to happen for us that are retired and on Medicare too? And will CalPERS have to then provide the health care? The short answer is yes. But I will just tell you, it will be very complex. It'll be very expensive. And so if you are not currently calling your representatives, please do, to make sure that they hold on to our Medicare as it is. And so with that, I'm going to open it up to your questions that you have now.
Thanks, Yvonne. Appreciate that. So it looks like Michael, you're first up. If you want to come off mute, you can ask your question.
Michael, you're still on mute.
Looks like you lowered your hand, so maybe that was an error. We'll go ahead and skip to Mary. If you do have a question, feel free to raise your hand again. Mary Scott, go ahead. You just click on the microphone, that should take you off mute to allow you to ask your question. Or maybe Renee, can you try to assist Mary by coming off mute? Okay. Well, maybe while we try to help her on the back end, we can go to Raj. Go ahead. We're batting zero right now.
I know, I'm thinking like, there's got to be something else going on.
Okay, it looks like you're off mute. Go ahead.
Okay.
Yeah, can you hear me?
Yes.
Yes, sir.
Oh, okay. Thank you so much for taking my call. I sent you an email last time when we had this meeting or this Zoom meeting, and for some reason I did not receive any answer regarding to that, and I was hoping that you would brush it up today, an answer to my question. But regardless, my question is about the retiree. I have retired for 5 years from the
Okay.
state of California, and
Uh-huh.
our retirement formula is capped at 2%. We do not get anything higher than 2%, whether is like in COVID era, we had 9.5% from Social Security, 8% from Social Security, but yet we only had 2% on for retirement, and
For
then
cola.
yeah, for cola. Then on top of that, this 2% that we are getting is based on the salary that we retired on. In the other hand, it's not communicative. So I don't understand how can we live with this kind of raises, and then on top of that, every year the insurance goes up or premium goes up. So the 2% that I got last year, it all went for the basically for the premium of the insurance, health insurance that went up. So, is there any way that you can review this formula and maybe change it or do something about it, please?
We cannot change the formula. The formula is set in law. And so that would take a bill from our legislature and the governor to sign it.
Well, maybe you can talk to a legislature and, to initiate that.
Or you can talk to your legislature, your local legislature. I'd invite you to schedule a meeting in their local office and go in and talk to them about it.
I see. Okay. Okay. Thank you very much.
Okay.
Floyd, you're up next. If you'd like to come off mute and ask your question. Oh. Floyd?
Can you hear me?
Yes, sir.
Okay. I have a question regarding, common practice. Is it a common practice that CalPERS would allow a school district or someone in the school district to change a retirement application without consulting the retiree?
I don't believe so.
Okay, well, it happened to me, and I did call the 800 number, and I've been going back and forth between CalPERS and the school district, and I was really trying to pinpoint who it was in the school district that actually called in the CalPERS to change my date. My effective date, according to the application I submitted on January 25th, was supposed to be, or it was December 31st. That was the start date of my retirement. My last day of work was December 30th. And I got a letter. I picked it up on the 27th of January, stating that my retirement application was changed. And now my new retirement date, effective date is January 1st, which makes me ineligible for the cost of living adjustment in 2026. Now I have to wait till 2027 to get my cost of living adjustment. So I went back to the school district to see if that can be corrected, but I only had like 18 days to do it, which was not enough time. And I went up the chain from human resources, the payroll, to the chief business officer. And, nothing was done. So the time has gone past. I was supposed to have tried to resolve this by February 13th. Well, after that, I just gave up because from my understanding that I couldn't do anything past that date. So, but what my frustration is, why would my application be changed without me being involved?
That I
Because
don't. So Floyd,
yeah,
that I don't know, but I've written down your information. I'm going to have somebody look into it and get back to you on that with more, a more focused answer. I would not have access to all that information myself, but I will ensure that it gets looked into and they get back to you.
okay,
Okay.
all right,
All right. Thank you, Floyd.
all right, thank you.
Thank you. Janet, if you'd like to come off mute, you can ask your question to Ms. Walker.
Hi. My question is, my husband will be turning 65 in January, and I won't turn 65 until 9 months later. And we're under his health through CalPERS. And we wanted to find out who we can speak to regarding that. That'll kind of send us in the right direction of coverage for me until I turn 65. And when my husband, right before he turns 65, will he get information from CalPERS to sign up with you guys for his Medicare?
No, well, he doesn't sign up with us for Medicare, but he will get he will get a letter, right? I think it's about 2 months out when I got mine,
Okay.
reminding me to sign up for Medicare, blah. And once you sign up, right, CalPERS automatically gets notified that you're signed up. And for me, it also said that like if I was going to change plans at that point, right, I could. Or if I wasn't, I could just do nothing and it would roll over automatically. Also, I will say up on our website, they have FAQs. Have your husband go into his into CalPERS on the website. I think it's in the My CalPERS page, but they have FAQs, and I remember that being answered about, like your spouse is one age, you're one age, and what are the different things that you have, because it's called a mixed kind of thing. So have him start there if that does not answer the question or make it easy for you, because sometimes this stuff gets a little confusing. It did for me, so I imagine it does for everyone. Call
Right.
the 800 number and let's see if we can, get you a more targeted response.
Okay, great. Thank you so much.
Sure.
Thanks, Janet. Rosie, you're up next. If you'd like to come off mute, you can ask your question.
Yes, thank you for taking my question. I know that you mentioned there had to be some coding for the district for substitutes, but my question is, I've looked at the documents for annuitants and I'm trying to understand what it means to come back and sub. Because if you sub, are you only allowed to sub, like say an office, I was an office manager. If they need an office manager for the day, can I substitute without being penalized? Or if somebody is out short term for a week, say, can I substitute that position? Because when you read the documentation that is put out for retirees coming back to work as annuitants, it's not clear as clear for substitutes in the school district offices. It's more like for police officers, or you can interpret it differently with what's considered an emergency situation. So I want to make sure I'm doing the right thing by subbing, because our district has put a stop to it. They're not allowing subbing anymore. But how do we, until they get it cleared through PERS of what it means, but what does it mean?
So I will just say that here's where the problem, I think, started. So school districts were coding it under government code section 21221 subsection H, right? But this is a specific code, and it's intended for higher level positions like city manager, right?
Okay.
But schools can hire RAs for extra help under government code section 21229, right? And so I think that I don't know, because I've not been involved with any of the school districts or anything like this, but just based on my experience, I think what probably happened is that for the school districts, a lot of them were using the same code for a very long time, right? And so, and didn't realize that there was a problem, and maybe CalPERS didn't either until an audit or something. They found that out, and they let the school districts know during one of their meetings that, look, you have to use this code, right? Because, the other code, it's for a specific thing. And I think confusion set in. We're working through it, but I think that's where the problem started and kind of still is. And I think that's why that one school district, they're having everybody go through, they're having the school districts, if they need a sub, go through HR and not have the school districts do it themselves to make sure that they're not running into any problems. Because I will tell you, when I first started on the board, I was hearing from retirees that, one, they had worked too many hours or different things that went on. And then there was money that had to be paid back, right? Because it wasn't being tracked properly at the school district. And so I think that they're just trying to make sure that they're not running into problems again.
Okay, so if the coding is correct, my part that I don't understand is, am I allowed to sub for say the office manager is out sick and that school office, elementary school office needs a substitute to cover her. Is that allowable? I mean, even under the proper coding, is it allowable? Because
I believe it is, yes, because it's supposed to be temporary. You're not supposed to be, filling in, but that they're not hiring, right? This is just a fill-in. It's a temporary position. It's a contingent worker, right? Which is
Right.
what a sub is. So yes, you should be allowed.
Okay, because they're saying that their interpretation of it, well, I mean, they're working with the school district on it with PERS right now, because their interpretation was that it's not considered an emergency situation. Because if you look at the verbiage is not clear, and that's something that PERS should really work on and have maybe even something more specific to. I don't want to dominate the time. I'm sorry.
I'd appreciate it, and I will pass this on, and I do pass it on
Yeah.
all the time. This is, I think it's just going to take a little, and when you think of all the school districts that we have, and they all do something a little bit different, it's going to take some time to work all the way through.
Right, because we're abiding by the number of hours, we're, waited the 6 months, all that was in place. And then when we went to sub, they're saying now that they don't know that that was legal for them to be doing. So maybe it's just the coding. So I will talk to our financial people at the district and see if it's coded correctly. Maybe that's the problem. I don't know.
I don't know either,
Yeah.
but yeah, this has been challenging.
Okay. All right. Well, thank you very much. I appreciate it.
Thanks, Rosie.
Thank you. Lindell, you're next. You should be able to click the microphone to come off mute. Oh, looks like Paul. Maybe you're up next. Go ahead.
Hello, can you hear me?
Yes, sir.
Okay, so I have a question. For background, I used to be with Anthem Blue Cross. They had a contract dispute with UC Davis Medical Group, and it looked like it was not going to be resolved. So then I switched to Blue Shield. here I am again. Now Blue Shield is in a contract dispute with UC Davis. And so it's been very frustrating when I pick an insurance plan thinking that, okay, they accept my medical provider, then they get into a dispute and then they no longer do. So I had a couple of thoughts. One, is there any way to discourage insurance companies from dropping major medical providers? And if they do, it would be nice if you could stick with them until open enrollment period starts again, so that you're not having to switch doctors midterm. That's
Right.
been very frustrating for me. And, I hope there is some resolution. The other thing the other idea I came up with is to allow open enrollment like it's a major event, like it may be before open enrollment period begins, but something happens major like this,
Right.
you lose your provider. It'd be great to have an open enrollment for those people to be able to find another insurance plan that does accept their provider. So those are the couple ideas that I hope that could be considered.
I will absolutely pass them on to our healthcare team.
Thank you.
Okay. Thanks, Paul.
Thank you. So let's try Lindell again.
Hello,
Hi.
Hi.
can you hear me?
Yes, ma'am.
Okay. So CalPERS sent a letter dated August 20th, 2024, stating in part, Blue Shield of California will be the new administrator for PERS Platinum Medicare Supplement. As a Medicare member, your provider network's care coordination services provided by your doctor, coinsurance, and copays will not change. End of quote. So my experience is with regard to acupuncture, that is not correct. When Blue Cross was doing it, I never had to do anything. Blue Cross billed, even though he was out of network. Blue Cross didn't care, and Blue Cross paid the whole thing. Under Blue Shield, now they're paying something, but I still have to pay $40 every time, and I had to bill it myself. And the information about how much they're paying is new, but I raised this fundamental question at the April webinar, and I sent a copy to CalPERS Stakeholder Relations, and at your request, I sent a copy to you, and I've never received a reply from anyone. So what am I supposed to do?
So let me start out by apologizing, not getting the response from me. And that slipped through the cracks, because typically what happens is I, forward it on to, the appropriate party. They get back to me, and I typically check to make sure that you have gotten a response. And this obviously slipped through the cracks. So I apologize for that. Lindell, I'm writing down your info again. Let me check into this again, and I will get back to you, but I will say, give me a couple of weeks. I'm going on to my mom's. I need to take care of her and my dad. I'll be gone for 2 weeks. So I'll get back to you once I get back. I should be back the week of July 4th, and I'll get back to you then. Is that fair enough?
Thank you very much. I appreciate your help.
Okay.
Thank you. I believe is it Sauri? How do you pronounce your name? You're off mute, but we can't hear you if you're speaking. No?
You hear me now?
Yes.
Okay, great. In great length, the same concern that the gentleman had about the Blue Shields and the contracts with the Hogue and UC. I live in Orange County, and half of the doctors are Hogue and the other half are UC. And if the contract with both of those are discontinued, that impacts a lot of people. Now, since then, I heard from Blue Shield that Hogue has agreed to the contract, but the UC hasn't. Now, I'm on Medicare, so I was told I will not be impacted as long as the Medicare accept the UC. But my husband is not, and we are paying high premium to be able to choose our own doctors and go to the best specialist that we want. Now, I echo the gentleman that said, why is this allowed in the middle of the year? People are having, doctors and treatments, and this is very, very stressful. So that is one of my question. And the other one was that when I received the email from CalPERS, I tried the Blue Shield. I didn't go anywhere. And then we were told go to Included Health, which is the total waste of money. That outfit, I don't know what their purpose is. They're not helping the patients, and I don't know if they're saving the CalPERS, but they're a third party, which they don't help anybody. And when I asked the CalPERS to contact the board members to send them emails, I was shut down. That I cannot contact the board members. Is that true? I mean, you are elected by the members in the PERS. So how can we contact you when we have a situation that we wanted to be heard? I mean, you're the only one of all the board members that have the town hall meetings. I haven't heard. I mean, I worked at the city of Santa Ana 35 years, and I've been retired 11 years. And since you've come on board, that's the only time I hear from board members. So how do we contact you?
So,
Thank you so
so I will say, they ask people first to go through stakeholder relations, send an email to stakeholder relations at calpers.ca.gov. But I will just tell you, for everybody I represent, you can contact me directly. And I've given out my email. I'll do it again. It's Yvonne.Walker at calpers.ca.gov. That being said, I will ask you that if you send an email, right, give me time to get back to you. I don't check my email daily. But yes, you can contact me directly because sometimes it's, helpful to have an intermediary like an ombudsman, go through and just see what's going on. So please contact me and we'll see where it goes.
Well, thank you so much because what I was told by the gentleman at the stakeholder, this I
Relations.
called, and he said, "Well, what's your message? I can pass it on." I said, "Well, why don't I just email you?" No, I cannot give you email, which is this
Yeah,
is
that's
really
frustrating, isn't it?
disturbing.
That
Yes.
that is frustrating. But we have now solved that problem, right?
Yes, thank you. So if my question again and the struggle is with the Blue Shield
Right,
contract in the
right,
middle of the year, uh, hanging us, dry
right.
with going out and finding new doctors.
Right. And and part of the challenge, I will tell you, part of the challenge for us here at CalPERS, we are not part of those negotiations. That's between two separate parties, right? And so
Yes, but
we're
the CalPERS decided to move away from Anthem Blue Cross,
yes, we did, and
which
we went with
never
Blue
had any
Shield,
problem,
right?
to
And
Blue Shield.
we thought that was a good decision. I thought it was a good decision. But and it'll happen again, probably at some point in the hopefully in the far distant future. But we make the best decisions that we can. But like I said, that between the UCs and Blue Shield, that they are in separate negotiations that we have no control over. Other than knowing that they're doing it. We don't sit at the table. We don't provide input, despite the fact that it is extremely frustrating for our CalPERS constituents, who in open enrollment chose you choose your health plan provider, based on your doctors. I did, right? I'm sure
Yes.
you did. And so it is extremely frustrating. I don't have a good answer for you right now, and I don't know that there is one, but it is something that we are aware of. And if there's anything we can do, I will advocate for that. And I will ask the question from the gentleman before, his suggestion of maybe, having a different open enrollment. I don't know if that's possible, but I will ask. We can see, right?
Yes,
To try to get to some solution. So thank you, sorry, and I'll look forward to your email.
thank you.
Thank you. Christoph, you're up next if you want to come off mute and ask your question.
Yeah, hi. Kind of related. It has to do with communications. Can you hear me?
Yes, sir.
Okay. Has to do with communications with CalPERS. I retired at the end of 23. I finally got my first check in April, I think, of this year.
Wow.
Yeah, and because it took a long time to resolve, and part of it was on me. I had a community property issue that had to be resolved. But the challenge is communicating with CalPERS. I call the 1-800 number. That person that answers the phone, very nice people, you got great people there, but they can only give me the information that I can get by logging into my CalPERS online. They can't give me any other information. They cannot connect me with anybody, and they cannot provide me any email addresses to anybody. They take my message, and then somebody in the correct department at CalPERS has 5 days to return the call. If I'm lucky, I'm home when they call or available when they call back. And even then, several times it took well over 5 days before I got a call back. And then if you want to send something in, you have two options: a fax machine. Who still uses fax machines? And or U.S. mail, snail mail. I've retired out of another system too, and I can upload all documents on the website for that retirement system. Instant feedback that it was accepted and received. And also then when I had to deal with community property, they have 60 days to respond, and it was rare that they actually did respond within 60 days. All those 60 days plus 5 days in trying to communicate with somebody made it take almost a year and a half before I could get all my stuff resolved. And it wasn't for lack of good people. It was the fact that I couldn't communicate with them in any timely fashion. And also there was no one person assigned to my case. It's where I could then establish a relationship, get their direct number, get their direct email, and we could resolve things quickly. Everything had to go through this process. They send me a letter, and then after the US mail gets it to me, then I have to call in if it's not clear in 5 days, and I don't even know if I'm going to talk to the same person. It's a nightmare. And there are better ways because, like I said, I've retired out of several public retirement systems. CalPERS was a nightmare compared to the rest of them. Can we improve? Do something to improve the communication
I know
system?
that they are working on improvements on our system, right? Our IT system. I certainly hope that that's one of the upgrades, because at the very least, being able to upload documents. And let me dig in more, because I know, and I direct a lot of people to call the call center, right?
Mm-hmm.
But when you have a complex case, and I would say that yours was probably a complex case,
Agreed.
you should it and I hope, maybe we don't, but I will find out. There should be a process where then you're dealing with like a caseworker, as opposed to somebody calling in just for general information, because I could see the frustration. If I were in your place, I would be so annoyed. And that's just
I
a
was.
mild way of saying what I would be. And so let me find out more about how that happens, because really it does not seem efficient to me. But I'm sure that I'm hoping that somebody will have a response that can make sense not only to me, because I feel like if it makes sense to me, then I can make it make sense to you. But what you described is I would be very, very frustrated. And so I apologize that you have gone through that and that it took you so long to get your first CalPERS check. Even though some of it, you had to work through things. I get that. But wow. Wow.
I think your idea of a caseworker is brilliant, and that's what I suggest. It's somebody gets assigned to your case and then you have some direct
Right.
communication.
Especially when it's, a complex case, because you don't want to
Exactly.
continue to reiterate what you don't want to start from zero every time you talk to somebody.
And I did have to several times.
Yeah, that would be frustrating.
Yes, thank you.
To put it mildly. Absolutely, Christoph.
Thank you. Daniel, if you'd like to unmute yourself and ask your question.
Yes, I want to kind of follow up on General. First off, thank you, Madam Walker, for taking the time. I think that's very beneficial for us.
Yeah, you can call me Yvonne.
I know. Well, I did. I retired from the legislature many years, and now we live out of state. Surprise, surprise, right? So I'm going to turn it over to my wife, who handles a lot of stuff. This is a follow-up on the acupuncture, and I think it's a much broader question with regard to how Blue Shield is trying to resolve some of the out-of-state issues, which are kind of like it.
So thank you. My name is Mara. Thank you.
Hi, Mara.
Hi. So we've been having acupuncture even before we moved to Oregon and California through the Anthem Blue Cross supplemental. We're CalPERS Platinum. So we have original Medicare and then the CalPERS Supplement Platinum. And we never had any issues with Anthem Blue Cross. Our provider billed them directly, and we had a $15 copay. When we moved to Oregon, again, it was pretty seamless. We have always had a $15 copay, and the provider billed Anthem Blue Cross directly. So when things switched on January 1 to Blue Shield, since that time, initially all of our claims were denied by Blue Shield. Then we called numerous times and we kept getting different answers from the representatives, even though Blue Cross or Blue Shield, I'm sorry, says they have designated agents for CalPERS retirees. We would get different answers. We were told it was going to be resubmitted and adjusted. Several of the claims were submitted and the adjustment was still no payment. So here we are in June. Our first claims were in January. We're still within the 20 visit limit now. Only 2 of our claims for my husband, for Dan, have been adjusted where Blue Shield has paid its share. All the others are still have been rejected. We've spoken to 2 representatives of Blue Shield in recent months who have done more, and they've escalated it. And presumably it was going to go to higher ups, and so that the claims would be paid. Only 1 claim got paid through that process. We spoke to a representative this morning, and she said she was going to do the process again. There's a designated, I guess, Blue Shield representative for out of state, and try and see if she can get these other claims paid, but was telling us that for some reason the system keeps rejecting them. So it's not seamless. And again, as the other caller said, it was represented that with the change to Blue Shield, all of our coverages would remain in place. And of course, this is a coverage we've been receiving that's very important to us for different conditions that we have. Acupuncture is a very reasonable means of addressing certain issues, and it's very helpful. So I think somebody maybe needs to intercede to find out what's going on with Blue Shield and particularly with out-of-state claims. And
they acknowledge that they have a system problem. Every time they submit these claims to their system, the system rejects it. Then they escalate it, and they said they'll get back to you within a certain period of time. The problem is they don't get back, and they don't actually, so if you submit the claim,
and the escalation isn't working.
No,
Correct.
their escalation is not working in their system. So whatever you can do to help on that front. And we know it's a whole big changeover. We get that.
Right. No, I get that, and you've been incredibly patient. So let me talk to our healthcare team, and see if we can help to figure this out.
Right. I should say, and I'll end it, that the individuals at their concierge desk have been very respectful. They're so they put on a good front. It's just, and we appreciate anything you can do on that front for us.
And I think
Okay,
it
absolutely.
also, you know, in keeping with this, I think the acupuncture services, which are part of the benefits beyond Medicare, should be explicit that that is a service that's covered, that the provider can bill the insurer directly, doesn't have to go through Medicare.
Right.
And that would really help with the process.
Thank you.
So thank
So
you.
that has been, so I just want to make sure I'm understanding. So that has been part of the problem, having to submit through Medicare.
Well,
And
yeah,
then
In some-
Medicare saying they don't cover it. So then, or it's
well, they can't
Yeah.
even submit to Medicare because these are services that are supposed to be provided beyond Medicare.
right.
So they
right.
and with the Anthem Blue Cross, the provider submitted directly to Blue Cross. They did not need to go through Medicare, and a percentage of the services, well, they had a set amount for
Okay.
in network, and then we've been paying a $15 copay, which is
Okay.
of course very reasonable. So it's
Yeah.
the process to be able to submit directly to Blue Shield and then actually get payment. We've now come out of pocket and we've paid our acupuncturist for all of the services we've incurred to
Right.
date.
And you want to I get it. Because the same thing, and now that I'm talking to you, happened to me, not to that extent, but, you know, I've had to be revaccinated from all my childhood vaccines. And there was one particular one where it got in denial limbo and took some time. And it was a significant one too, and took some time to get that resolved because they were going between Medicare, and then, you know, Medicare didn't cover it because, you know, at my age, I shouldn't be getting it. And then, you know, and it worked out, but it was, so I get it. It was a very stressful time. This makes more sense to me now. I have a better understanding, not that it didn't make sense before, but I have a better understanding. So let me talk to our healthcare team to see what, if anything, we can do.
Okay, thank you so much. We appreciate it.
Okay, thank you.
Thank you. I think we probably have time for maybe one more question, Yvonne. How's that sound? Depending on how
Yeah,
long
one
it goes.
more, and then I want to do a little bit of a wrap up.
You got it. So Kath, it looks like you're next on the list. Go ahead and come off mute and ask your question, please.
Hi, the board of CalPERS has a basic fiduciary responsibility. When a stock carries an outsized risk, such as Tesla now surely does owing to Musk's political activity, the prudent move is to stop buying that stock and reassess whether it's a wise investment of the public employees' money. Will the board consider divesting from Tesla?
I will tell you that the board is looking at everything. We
Okay,
take our fiduciary duties extremely seriously. And so we are looking at everything.
Okay, thank you.
So before I go, I just want to, I want to thank all of you for getting on. The questions were really great. I appreciate them. We will do like we do, like we've always done, but some of these are very specific. But for those we didn't get to in the queue, we have your questions, we'll send out responses. We'll, you know, bundle them up so that like questions, we can put them all together. And at any rate, so we'll do that also. And for those of you who had specific questions that I said I'd get back to you, I just want to remind you, I'll be out for about 2 weeks. It might be a little bit, but I will get back to you. I've written it down. But one thing I've been doing at the meetings that I've been able to get to is I'm just reminding people that if you do not have your CalPERS special power of attorney form on file, you need to make sure that that happens, right? Because just imagine you're incapacitated and say your daughter that is handling your stuff, she will not be able to communicate with CalPERS. We will not be able, without that special power of attorney. So whoever it is that you want it to be, you know, you should just go in on your My CalPERS, check the form. If you have one, great. But if you don't, make sure that you get one on file so that, you know, in the case of, you know, you're not being able to handle your own business, your business can still be handled. That's incredibly important. And I know for some of us, we have filed the paper a long time ago and we never went back to look to see, is that person still the same person that we want? I would encourage all of you to make sure that you go in and get that done. Again, thank you for getting on. You guys really give me a lot of air, so I appreciate it. This will be on our YouTube station, and it'll be up on our website for the board. And our next time we talk, it's every other month. So this is June, July. It will be August. So I'll see you guys again in August, and thank you so much.
Thank you. Have a great day. Bye-bye.
Bye.